The Vascular Anomaly Center is dedicated to the care of patients, both children and adults, who have vascular anomalies. The patients we take care of have probably more than 40 different diagnoses, such as vascular tumors like hemangiomas or vascular malformations, venous, lymphatic, arteriovenous combined malformations. Our services include diagnosis, evaluation, treatment of patients, as well as consultations both domestic and international with physicians, patients, and families. Our center is composed of a team of physicians representing 17 specialties, as well as nurse practitioners, a social worker, and an administrative coordinator. All of us have developed a subspecialization in the field of vascular anomalies.
And there have always been these patients with various types of vascular malformations and other anomalies that nobody knew anything about. Patients are relatively rare, and there was no consolidation, or there was actually no knowledge of these patients.
I would just imagine campus walking from class to class.
Why using the pump and the compression more consistently would be good.
Okay.
Because Merrimack is a pretty good sized campus.
Yeah.
You know,
Yeah.
are they going to let you bring your car onto campus? And,
Yeah.
Okay. So I think some things just to think about. You know, we kind of talked about kind of the stressors and just kind of first semesters can be a little rough with college, just kind of getting used to the
And probably the biggest advance or breakthrough that's come, I think, in the past 30 years has been Dr. Mulliken's classification system.
In the past, patients with vascular lesions of various types have all been labeled hemangioma. Hemangioma is a tumor, and there are other types of vascular tumors. And on the other side, there are vascular malformations. These are not tumors. Together, the tumors and the malformations constitute a new field of medicine, which I thought was best termed vascular anomalies. Anomalies simply means not normal. These are not normal structures. So vascular anomalies is a field that insinuates itself between many medical and surgical specialties, practically all of the medical surgical specialties.
I was attracted to caring for patients with vascular anomalies by Dr. John Mulliken, who is one of my strongest mentors and who has really devoted much of his life and career to really creating. He gave birth to this field of vascular anomalies. And his passion is to get each of us from different disciplines involved in understanding our piece of the patient with vascular anomalies. For example, I'm a pediatric general surgeon. I'm trained to operate on the insides, on the chest, the abdomen, the genitalia. He's a plastic surgeon and operates mostly in the skin and soft tissues. Due to his large experience and reputation in the field of vascular anomalies, he had for decades been referred patients or asked for opinions on patients who had vascular abnormalities on the insides. And he felt frustrated that there was nobody who was an inside type surgeon who would look at these problems or had any experience with these problems. I care for many patients with vascular abnormalities in their intestines, in their lungs, in their livers, in their genitalia, and these are problems that really hadn't been addressed before.
My interest is primarily with extremity surgery, peripheral nerve surgery, microsurgery. So I'm one of the hand plastic/orthopedic members of the team, and I've been here since the incipient years and seen a lot of changes in the treatment of these patients.
I'm involved in the diagnostic part, which is evaluating the images and the diagnostic studies and recommending the diagnostic studies needed for these patients. Many of these patients will eventually end up coming to the interventional department for what we call the minimally invasive treatment, which is basically treating the vascular anomalies without surgery, without making incisions in the skin. And the procedures we do are basically embolization for high-flow malformations, sclerotherapy for low-flow malformations, and some other adjuvant treatments such as laser photocoagulation and laser photoevaporation.
Here at Children's, certainly we probably have the greatest experience of these. We are a worldwide referral center. See what we would consider the bread and butter type vascular anomalies, but we certainly see the most challenging, complex ones as well, and we treat both. And I think that's again a credit to the multidisciplinary part of our nature, where we're literally have in the same room plastic surgeons, general surgeons, people from the research arm working on anti-angiogenic type therapies that I think that really, when you get all of them in the same room, it's a very fruitful discussion. Every patient really gets the full attention of almost multiple disciplines whenever, especially here in when we have our clinics, the same thing. They're all in the same room at the same time. We can have cross-specialty discussions in terms of determining what is the right treatment for the patients.
All of the physicians, regardless of their discipline, are focused and have a significant amount of empathy towards the patients, and so we've all devoted our professional careers toward this problem. My goal and the goal of the center is to hopefully someday come up with better medications and drugs to treat patients with vascular anomalies.
So for me, the great gratification is providing an opportunity for patients that had little to look forward to. These patients still today frequently go from doctor to doctor and center to center and are told, we've never seen this. We don't know what to do. Here, because of our large volume experience across multiple disciplines, we are much more comfortable offering hope, offering our experience. We still very frequently see patients with conditions that either we've never seen before, or a little bit different than we've seen before, or we're not really certain exactly what's going on, but we have a pretty good perspective. And we've gotten very comfortable acknowledging to families and their doctors that, well, we're not exactly certain. We've never seen exactly this type of situation before, but it's very closely related to these other patients we've seen, and we will help you figure out the best way to go forward. That gives tremendous comfort to patients who are used to being told, we don't know, we can't help.
I'm a plastic surgeon by training, a general surgeon and a plastic surgeon by training, but I found early on that I was attracted to problems in children. And I was more attracted to problems in children that were congenital rather than acquired. I always thought that acquired problems, whether it's a fracture or a burn or something that happens, is more of an accident and should never have happened in the first place. I was more concerned with accidents of genetic cause, abnormalities in the genes or abnormalities in the formation of structures were more fascinating to me. I hate the fact that children are born with anomalies or abnormalities. And so I love to treat them, I love to take care of them, I love to make them better if I possibly can. But still, I hate the subject that I'm working on because I don't think the kids deserve to be born with abnormalities of this sort.